spending priorities emerge from the Appropriations Committee, and you're going to see some serious tax cutting proposals from the Revenue Committee. Among those proposals will be one that's already advanced on the floor, which gets rid of all income tax liability for military pensions and retirements. This will especially help folks in the Bellevue area, but it will help all of us. And there's a pretty serious proposal that would, over 10 years, eliminate income tax liability on Social Security income, which we're one of the few states that tax that. So you're going to see that and some other changes coming to our tax system on top of a bunch of property tax relief. In the next 2-year budget right now, before we add any of this extra money in, there's going to be about $650 million in direct property tax relief to property taxpayers, which is really going to help on the ag side. My priorities as the senator in the Norfolk area, first and foremost, is a bill to adopt the Nebraska Innovation Act, which would let banks have custody of digital assets like cryptocurrency. In its current form, it allows for the creation of a new cryptocurrency bank charter. I know people think these are opportunities for places like Denver and Dallas and Omaha and Lincoln. The reality is we have more state bank charters than almost any other state in the nation, and our banks can become a part of this, which will create the kinds of jobs that we need to create in Nebraska. My other 2 bills are one that updates the Open Meetings Act to let meetings like this virtually take place for different political subdivisions. And my 3rd priority bill that's been prioritized by Senator Hughes from Southwest Nebraska is a bill that allows industries like ethanol plants to capture their carbon emissions coming out of the bin and drill it 5,000 to 10,000 feet below ground and sequester the carbon, which would allow our ethanol industry to qualify for some of the very lucrative tax credits available for carbon sequestration. So those are the bills that I'm working on. We have a great group of Northeast Nebraska senators, many of whom you're going to hear from today. We work very well together. We are in constant communication, and given the changing demographics of the way that Nebraska is growing, it's so important that we all work together to bind all of our communities together to make our voices heard. There's no room for error in not being on the same page, because there's simply not enough of us rural senators and Northeast Nebraska senators to have the kind of impact we want. So with that, I want to thank Denise and the Norfolk Chamber and all your chambers for getting together today. And if there's time for questions, I'll certainly answer them, but this is great.
Thank you.
Thank you, Senator Flood. We appreciate what you do to represent Northeast Nebraska. This is Tina again from the West Point Chamber here at the State Chamber's office. Next up is Senator Ben Hansen of District 16. He has the honor of representing 2 of our chambers that are recognized here today, both West Point and the Washington County Chamber of Commerce. So Senator Ben Hansen, thank you for making time for us today.
Thanks, Tina. Can you hear me okay?
We can.
Good, all right. Well, Senator Flood stole some of my thunder a little bit. Even though he used to be the speaker and he likes to talk a lot, so I should have expected that ahead of time. But he addressed Highway 275, and we just did get the environmental impact study back and we're start seeing the ball rolling, I think, on that, which I know has been a concern among especially people out near West Point and the Scribner area about getting that highway up to 4-lane. And so I'm kind of excited to see that information come back, because everybody knows how long, who's ever been in a city council involved in local government knows how long anything can take. Whenever you get the EPA involved and environmental studies involved, it can take years. And so it's kind of nice to see some of that going. And I know Senator Flood also addressed, which if he's not listening now, I'm still going to give him a hard time about it later, that since he joined, now all of a sudden we have a whole bunch of money. I like to think it's because the last 2 years since I joined and all the bills that we passed, now we're seeing a lot more revenue. And so I think that's actually the reason why. So, but you know, that's neither here nor there. So anyway, one of the things I want to touch on, along with some of maybe my priorities, but what's been going on in the Business and Labor Committee. Some of you might know that I got elected chairman of the Business and Labor Committee this year. And it's been an interesting last couple months when we've been going through committee hearings. Been learning a lot about the dynamics of different senators on my committee and how best we can listen to everybody and get all their thoughts and so we can do the best we can with the time that we have. So in Business and Labor Committee, we did have 32 total bills come through this committee this year. 12 of them did advance. And a lot of the bills that came through this year in the Business and Labor Committee had to do with workman's comp issues, COVID, issues relating to COVID, specifically in the meatpacking industry. I know that was Senator Vargas's bill that came out that he prioritized. Other kinds of regulations when it comes to business, especially when it comes to compensation issues, trying to think of paid family leave. And so some of these are the issues that really address a lot of businesses that are involved with the chamber, especially the smaller businesses as well. And so we've been going through a lot of those, trying to figure out which ones are going to be best to get on the floor, that have a good history, that hopefully won't give too much trouble to the speaker on the floor when they come up there, because we have to look at the institution as well. And so 4 of those did get prioritized that we will be hearing this year. Just to touch on them, because they might kind of relate to different aspects of who's listening today on this Zoom call. One of them was, like I mentioned, Senator Vargas's bill that has to do with how the meatpacking industry will change some of their policy and procedures in response to COVID-19, such as distancing out 6 feet, PPE. And so we'll be hearing that one too. Another bill from Senator Vargas that Senator Matt Hansen prioritized has to do with the Healthy and Safe Families Workplaces Act. We'll be hearing more about that here pretty soon. Senator McDonald is going to prioritize changing provisions of the employment security law relating to the disqualification of certain aliens. And so it has to do with specifically a subset of workers, specifically maybe DACA workers and other people who are here through possibly, I think, visas, and how they're going to get unemployment if they will or if they won't. And so I think they're trying to open that up for them. Again, that'll be an interesting conversation when it comes on the floor. Senator McKinney prioritized what we all call on the floor the hair bill. That has to do with protecting people, not so much of a certain race, but of a certain hairstyle that has to do with a certain culture. I think this bill came up last year and it got vetoed by the governor, actually, because there's some concern that it was actually defining race in statute, and then how would businesses then, how would that affect the Civil Rights Act and how people can then interact with their employees when it comes to race. So he's actually been working pretty well with the governor's office, and I think they came to a compromise about how they can best move this forward, so they can have some consensus on both ends. So those are just some of the bills that will be coming up in business and labor. The one bill that I prioritized this year was LB 644, and then that's called the Property Tax Request Act. So what this basically does is whenever a taxing authority, such as a city, a county, a school district, community college, whenever they decide to increase their property tax asking, they have to be included on a postcard that will be sent out to every constituent that the tax is affected by, saying this is what your taxes were before, this is your evaluation, and this is what your property taxes are going to be like after this gets passed. And then we set up a separate meeting or a hearing then that these taxing authorities would have to go to, talk for a little bit about why they're increasing their taxes, and also provides a forum for the citizens who are getting their taxes are getting increased to come and discuss that about maybe why they don't like it or why they do like it. So we're just trying to open that up so we can be cohesive in how we're going to address property tax issues and give the power to the people and give them a hearing on where they can kind of voice their opinion. So those are just some of the things that I've been looking at and prioritizing and dealing with in business and labor. So I don't want to take up too much of your time because I know you got other people to talk, but I'd be open to any questions if anybody has any specifically.
Yeah, if anybody has questions for any of the senators, you can go ahead and unmute yourself and ask, and we'd love to take a couple questions at this point. You can also put it in the chat as well.
As long as they're not hard questions, I'll be fine. Good, perfect, love it. None, even better.
Very good. Okay, well, thank you again, Senator, for your time. Irene, I'm going to turn it over to you.
Thank you. Again, I'm Irene Fletcher-Mock from Wayne Area Economic Development, and I have the opportunity to introduce our friend, Senator Joni Albright from District 17. Good morning, Joni.
You are on mute, Joni.
How can you hear me okay?
Perfect.
Happy St. Patty's Day. I have my green on. Looks like everybody else is trying to comply here. Well, real quick, my priority bill is LB 281, which we call it Aaron's Law. Many of you know Michael Carnes from Wayne asked me to carry this bill. He had Senator Bloomfield carry it 6 or 7 years ago. Never came out of committee. It did come out of committee 8-0. It'll be on the floor. It's a bill that will basically require that all school districts in Nebraska implement a prevention-oriented child sexual abuse program. So the children, 4 hours every year, will be talked to by, with age-appropriate information for the children, all the way K through 12, so that if they are being abused in any way, they reach up and reach out to their teacher or counselor and get that taken care of. Because with the climate we are in today, with sex trafficking, people grooming our children, it's something that needed to be done. I obviously maybe had other bills that were something that I would have rather have prioritized, but that one I felt was very important. If I could save one child, that's important to me. So what I did get passed through Revenue Committee, which I'm serving on Revenue this year instead of for the last 4 years I had been on Natural Resource, but felt it was time to move on. And in doing so, I had the Renewable Fuels of Nebraska come to me with a bill that the ethanol plants had been being charged through the Revenue Department a sales tax on their inputs. And generally speaking, we don't do that. So we're going to bring that forward. That will be a committee bill that comes out with many others items that will be on it. And I'm probably not at liberty to say what that is just yet because it hasn't been kicked out, but it will be the lead on the committee priority bill. And so I'm excited about that. Also, I'm serving again on transportation and telecommunications, so I won't repeat what Senator Flood, Senator Mosher talked about, but we are going forward with Senator Wall's bill. That was her priority. I drive 275 to get home. I think it's important that that get finished. It looks like they are in the works because when I go through West Point through Scribner, they do have all of the trees being pulled out right now, and they are definitely working on that portion of 275. The other thing is the broadband. I think that's important to all of us. We learned through COVID how important it was for the families to be able to have access to the internet and not have to go sit outside of the library or McDonald's or wherever to get their homework done. And more parents are home now because of COVID, taking care of business. And I'm excited to support the governor's priority bill, which, excuse me, gives $20 million this year, $20 million next year to the underserved areas. That would be people who don't have internet right now in their homes, not just to make internet better for those who have it, but to take care of the underserved areas. So that's important to me to make sure that gets out, along with several other I would say broadband issues that involve public power, cities, the actual vendors themselves. We're still in conversation about a lot of that. Let's see, and in revenue, this is something we all need to be just looking at and watching, but the consumption tax that Senator Erdman has proposed certainly needs to be able to show all of us a few more numbers, whether we can really do this or not with our population in the state of Nebraska. I really don't know that we can support that, but it would take quite a bit of work to look at the numbers. And I'm encouraged to think that if it was just one sales tax and we didn't have to worry about property tax, income tax, or the other, or even inheritance tax, that's another thing that was kicked out of with Senator Clement's bill 310. But looking at that consumption tax, if there's some numbers that we can all take a dive into and find out if it's really going to be feasible for the state of Nebraska. If not, there'll be many other bills that come forward to help us through some of that. So that's me today.
Thank you so much. We really appreciate it. We have a question come in for Senator Hansen. Are you still on the call, Senator Hansen, or did you hop off? Yay, you're still there. All right, Tina will ask that question.
So it says, Senator Hansen, how would 644 budget hearings work for community college districts representing 20 counties?
Yeah, and I kind of responded to that in the message too, but I can explain a little bit more here right now. But that was a concern that we heard among community colleges and I think ESUs as well. And so working with some other senators trying to put an amendment together that might actually have the community college or taxing authority who's located in multiple counties to only have to attend the meeting in the county that they're located in. So for instance, like Platte Community College, which is where I went to, Central Community College in Platte would only have to attend the county meeting in Platte County instead of having to go to all the ones that they're located in, just to kind of keep things narrow. So that way if people do want, they at least have some kind of forum to go to discuss any kind of tax increase instead of having to go to multiple counties. So that's one of the things we're working on right now.
Thank you so much. I think we have another question come in as well.
Okay, so the next one is, do any of our senators have any opinion on the news of the Nebraska Education Department wanting to talk with grade schoolers about gender identity in kindergarten, 4th and 5th grade?
Joni, or
Senator Albright?
I'd be happy to talk about it. I want every parent to read through all of the suggestions and to give their opinion. I think that's the way this needs to happen. And I think with the more input they get, the more they're gonna know and understand where the people in Nebraska feel and stand on this issue.
thank you. Any other senators want to comment on that?
I can quickly, yeah. I agree with Senator Albright. I think one of the best things that we can do is make sure we get the parents involved. Because a lot of times we can do a lot of things as legislators, but I think when it really comes to what we try to encourage, which is local control, especially when it comes to our school systems, I highly encourage our parents to get involved, go to school board meetings, email or call their administrators and their school board members and voice their opinion. I think that's bigger than anything else we can do right now. So I agree with Senator Albright on that.
This is Mike Flood. I haven't actually had the opportunity to read what the State Board of Education has put out. I can tell you that I have a number of constituents that are in Madison County, especially that are very concerned with some of the proposed new guidelines that would come from the Department of Education. And I've been asked many times, can we have a bill that would, can there be a bill to stop this? And the answer is our deadline for bills passed earlier in January. So anything that would be done in the legislature would have to be done next year. So I think to the point of the other senators, this is a public process. There's a public hearing that's happening. I think this is one of many conversations states are going to have. I'm getting a lot of communication about transgender athletes participating in women's sports and so forth. And I think that the legislature is probably going to have to define a way forward next session. And I want to get my hands on what is actually being proposed and where our State Board of Education members are, which I haven't had the chance to do. I do see there's a question for me from Nick Verbga. Can Senator Flood elaborate on his comments about the number of Nebraska banks? So in the state of Wyoming, they were the first state in the nation to allow for cryptocurrency bank charters. And there are only 26 state chartered banks in the state of Wyoming. In Nebraska, there are 147 state chartered banks. We have a lot of state chartered banks, and that's down from like 400. They are dwindling as consolidation is taking over. The state of Arizona, I believe, only has 4 or 5 state chartered banks. That's how much consolidation has happened there. One of the benefits with my cryptocurrency legislation is that with more state chartered banks, if they were given the powers, there would be more opportunity, I think, in this sense for innovation, given the way the banking rules work. Of course, my bill would also allow you to start a novel digital asset bank under the Nebraska Financial Innovation Act. So I hope that helps answer your question, Nick.
Thank you so much, Senator. Hopefully, Nick, that answered it. If not, you can go ahead and comment in the chat again and ask a little bit more. But we are going to move on to the next person on the agenda, a man that needs no introduction. We have the Honorable Pete Ricketts joining us today, the governor of the great state of Nebraska. Pete Ricketts, or Governor Ricketts, I don't see your green. Where's your green at today?
You know, I don't have a green suit or even like I got one old green tie. This is kind of ugly. So I said, you know, my family's actually kind of Welsh, so I'm going with red today.
All right, very good. Well, thank you for joining us, and we'll give you the floor to say a few words to the folks.
All right, thanks, Tara. So about 10 minutes, is that what I understood? 10 minutes, all right, great. I'll try to make it brief. Well, first of all, one of the things that's been dominating all of our lives for the past year, in fact, we just reached the 1-year anniversary, is this pandemic. Yesterday was the 1-year anniversary of President Trump's 10-person rule that really put our state and the entire country on a lot of restrictions. And we, of course, here in the state of Nebraska followed the president's guidelines, but have worked to protect our hospital capacity and really use that as the driver to be able to, manage this whole pandemic. You may recall in April of last year, we did our 21 days to stay home, stay healthy, stay connected, to really ask Nebraskans to limit their mobility. We never did a statewide mandate on masks, for example, in the state. So we tried to really balance out slowing the spread of the pandemic and slowing the virus with allowing people to live a more normal life. And I think we've been very successful about that here in Nebraska. We created our 7-pillared plan that included testing, where Nebraska hired a private company, did a public-private partnership that at one point was basically doubled our testing capacity here in the state. And right now we're the 15th best state for testing. We did hired up over 1,000, in fact, at one point, 1,500 contact tracers at the state to be able to assist local public health departments, because testing and contact tracing is kind of the blocking and tackling of how you manage any sort of pandemic. We created space through the Nebraska Accommodation Project to allow people to go, if they couldn't go home safely, either from work because they're worried about bringing the virus home, or going to work because they didn't want to bring the virus to work. We provided PPE to folks. This is our 4th pillar, was providing personal protective equipment to first responders and healthcare workers and so forth. In fact, the state has spent over $50 million on personal protective equipment that we provided to folks and still continue to provide to local health departments. Our 5th pillar had to do with creating plans around long-term care facilities and meat processing plants and so forth, to be able to help them take special steps, because those venues were more at risk because of the nature of the congregate living or the working environment. And then, of course, number 6 was our DHM, our directed health measures, that were ultimately all tied back to that hospital capacity. And then finally, number 7 is our vaccination plan. And we've been rolling that out here since December. And if you look at all those together, what we've done is really slowed the spread of the virus, so that, for example, when it comes to our hospital capacity, which is what we really based all this on, we've been able to provide that hospital bed, that ICU bed or ventilator to anybody who's needed it when they needed it. We're at 133 hospitalizations right now, which is about 3% or so of our overall hospital capacity. So really at a spot where we were at the end of last July, early August, before we hit the surge in the fall. And then with regard to vaccines, we focused on the folks who are most at risk. We went to long-term care facilities, healthcare workers. We focused on 65-year-olds and plus. And actually, we are either the top state or one of the top states for the highest percentage of 65-year-olds and older that we've vaccinated here. And that's great, because again, those are the folks that are most at risk. 83% of our deaths have occurred in folks 65 and above. And with regard to vaccines, I expect that we will, in the next couple of weeks, have several health departments that will be moving into phase 2. And they'll go to phase 1C and then phase 2. And then I expect that most of the state will be in phase 2 either by the 1st or 2nd week of April. So probably the last ones will be Douglas and Lancaster County to be able to get there. And what that means is then we'll start with 50 to 64-year-olds as the 90% of what we'll direct public health departments to focus on as the next risk category, but also allowing for folks with underlying healthcare conditions. And those will be set by local health departments and providers, healthcare providers, doctors, and so forth, working together to be able to make that happen. So that's kind of what we expect to have happen with regard to the pandemic here over the course of the next several weeks. And we expect to continue to get vaccines here in our state and continue to get them into arms as quickly as possible. Typically, depending on which ranking you're looking at, like in the CDC, we're generally around rank number 10 or 12 with regard to the most people getting vaccines per capita. New York Times, we fall a little bit lower on their rankings, generally, depending on how they're looking at the data, anywhere between 15 and 22. But, and we want to continue to look for ways to be able to improve upon that, to be able to do even better. While getting people vaccinated and slowing the spread of the virus, we've had, in 2020, we actually were able to strike that balance such that we had, on average, the lowest unemployment rate. In fact, we had the lowest unemployment rate for 6 out of the last 9 months. We've been able to get kids back in school. In fact, Nebraska ranks number 2 with regard to getting kids back in school, only behind Florida. And so that's really helped us recover or get back to a more normal life. And you see that in the revenues we're having at the state. And that's going to be key because I'll kind of bridge to the next thing is legislative priorities. I saw you just had Senator Flood on. I proposed a budget that's only growing at 1.5% per year for the next 2 years. So we continue to be fiscally conservative from that standpoint. I proposed a budget that would also allow for $1.36 billion in tax relief. And with the additional forecast we got in February, we can take that up to $1.77 billion in tax relief over the course of this next biennium, leveraging the bill we passed, LB 1107 from last year. We also have a veterans tax relief package where we want to get the second half of the veterans tax relief we got last year. So we'd fully exempt veterans military retirement benefits. That would put us on a level playing field with 5 of the 6 surrounding states to us and allow us to retain a very important workforce that we're losing right now. For example, South Dakota and Iowa are growing their veterans population at 2 or 3 times their normal population growth. Ours grows at half. And this is a workforce that's already developed and key for our employers to be able to hire people. We also have important initiatives with regard to rural broadband. I'm proposing spending $20 million over the course of the next 2 years with Chairman Friesen of the Transportation and Telecommunication Committee, as well as Speaker Hilgers, to be able to get that done. That's going to be important to connect 30,000 Nebraska households out of the 80,000 that we have that don't have that 25 download, 3 megabit upload speeds. So again, which was really kind of table stakes for broadband access and something that everybody needs to have access to here in the state. While proposing property tax relief, we're also proposing limiting spending to make sure that that tax relief we're providing is going to people's pockets. Local property taxes have gone up nearly 52% over the last 2 years, or last 10 years rather, compared to incomes going up 48% and inflation only going up 18.7%. This is why people are mad. They see property taxes going up faster than inflation in their own incomes. And so our proposal is to limit that to 3% a year. And just remember, I'm proposing a budget at the state, it's only growing 1.5% a year. So we're setting the example here at the state. And then while doing that, we're also proposing record amounts for K through 12 education, $1.1 billion in each of the next 2 years, additional money through career scholarship program, additional money for the textbook loan program, and then expanding our our additional money for the career scholarships to include private colleges, as well as the community college, state colleges, and the University of Nebraska. And then a program for opportunity scholarships to allow parents to have choice where they send their kids. So Tara, that was a lot in a really short period of time. I got it under 10 minutes though, I've been timing myself. I got probably time for one question if you want to take it.
We do have a question that was in the chat. So it says, Governor Ricketts, Iowa just announced that all Iowans will be eligible for a vaccine by April 5th. How do we get Nebraska to this point as well?
So again, we're prioritizing based upon risk. So we want to make sure the people who are at the greatest risk get the vaccines first. And that's why we focused on 65-year-olds. So we'll go next to that category 50 to 64. And that's because if you look at, say, the category from 50 to 59, that 10-year cohort, twice as many people in Nebraska died in that cohort as all the people who are age 49 and under. So that's why we're going to continue to focus on age first rather than just opening up to everybody, because the folks that are older are going to be at higher risk. I do expect that by the time we get into May, certainly by the end of May, we're probably going to be at that point where just about anybody can get it. That's certainly part of our schedule that we've been published. We've had a schedule published out there for a couple of months now that shows by the time we get to May, that's when we'll be just broadly into the general population. So I expect we'll be there, but again, we really want to focus on folks who are older because they're at the greater risk of passing away from contracting the coronavirus. And we want to make sure we get those folks first, because that's one of the things, one of the things we've done through this pandemic is we've really limited the mortality rate of the folks here in the state. In fact, we've got the lowest mortality rate of any of the states surrounding us except Colorado, and they're just only a little bit behind us, whereas a lot of other states are way above us. So we want to make sure we continue to focus on people most at risk to limit the fatalities we're having from coronavirus.
Wonderful. Well, thank you for all you're doing. If you have time, I think we'll probably take one more question. If somebody wants to put it in the chat quick or unmute yourself and ask, that'd be great. Otherwise, I'm going to ask, who'd you pick for your bracket this year? Who's winning the NCAA?
Oh, Creighton University, of course.
Great answer. Spoken
No, it's funny. I got the bracket in the paper, because it came in the paper, I think Monday or something like that. And I set it on my kitchen counter, but I haven't done anything with it because it's just still been sitting there unfilled out. So sorry, Tara, I hate to break it in. I haven't, I got this day job called governor. It's kind of busy, so I haven't really had time to go through that stuff.
I need to give you a break. I tell you what, no time you've filled a bracket. All right, well, I don't think there were any other questions. So again, Governor, we so appreciate your time. Thank you so much for being with us today.
All right, well, hey, thanks. Hey, I just want to say thanks to all the businesses, because I know you all have made a ton of sacrifices through this pandemic and have worked very, very hard to keep people employed. Just want to let you know how much I appreciate all your efforts and all the innovation and creativity we've seen to be able to, again, help Nebraskans get back to a more normal life. So thank you all for what you're doing, and have a great rest of your week. Happy St. Patrick's Day.
Thank you. You as well. All right, we're going to detour a little bit. Senator Walz, unfortunately, got called into a meeting, so she's not going to join us till about 1, but we do have Richard on the line with us. So I'm actually turning it over to Luke up in Wayne to do that brief introduction for us. Go ahead, Luke.
All right, thanks, Tara. Really happy to introduce Richard Beyer. He is the president and CEO of the Nebraska Bankers Association. He's got a lot of experience with economic development and chamber work across the state of Nebraska. And though he's not a native Nebraskan, I think he's shown over the last several years that he does have a passion for the state. So welcome, Richard.
Great. Thanks, Luke. Good afternoon. It is a pleasure to see everybody. I see a lot of friends on the screen, and so I do appreciate the chance to connect virtually, and hopefully a year from now we'll all be back together in person. I know that Brian Sloan and I laughed the other day. I think the only thing he and I might be learning on all these Zoom calls is that our hair is getting thinner on the top, which I find really irritating, but it seems to be one of the life lessons from being on Zoom. So if you don't mind, and I'm not sure who's got control, but if it's okay, I would love to share my screen just a minute.
You should be able to, I think. All right.
Let me know when you see it, if it's good to go.
You can see it.
Perfect. Well, thank you. And I just want to touch briefly when I was talking with Luke originally about this, just to touch a little bit about what the banking industry has been doing over the last year to kind of help our fellow Nebraskans. And just to give you a quick snapshot, you heard Senator Flood's numbers earlier today, and just to give you a quick snapshot of the industry, what we're seeing out there in terms of sheer numbers and size. And, the banking industry as a whole continues to have about between 14 and 15,000 people working for it in the state of Nebraska. 159 of those are chartered in our state as either savings banks or traditional community banks. So give you some perspective, and most of them, as you know, are focused in commercial, ag, mortgage, and then a lot of limited consumer activities. And so our members have done a great job. They've been on the front lines in this COVID situation in terms of trying to help our communities and our customers. So just touch briefly on a couple of quick items. Our first and foremost, when this process started, we were just looking back just a little over a year ago when we made the decision to start shutting down offices and lobbies. And obviously financial security was an important issue for our customers across the state of Nebraska. And did they have access to what they needed to be able to make sure that they could get cash, they could be able to pay bills? Did they have access? And that included things like lobby closures, trying to make sure that people had the services that they needed. We also ran into some weird issues that I would tell you over the last year that a lot of folks didn't see or don't have an appreciation for maybe. And that's things as simple as kind of towards the election, as we were going through the election cycle, really taking a look at for example, cash runs. We had a couple of locations in the state of Nebraska where people coming in and pulling out thousands of dollars in cash out of their accounts, concerned about the financial services sector in America. So we had to work really hard to make sure that they were safe and secure in that process and to help them understand. We've also been kind of first and foremost in terms of loan forbearance, trying to prevent evictions, and then doing loan modifications. So that's taken up a lot of time. And then you throw in the mortgage refis, and we've seen lows. If you've not refinanced or didn't refinance over the summer, if you had a mortgage, shame on you, because you probably missed a great opportunity of a lifetime. And so I kept our folks really, really busy. We're actually waiting on our mortgage numbers to come out of Nebraska to get a good feel about what that looks like. Luke asked me to touch briefly on a couple of things, and that was really the issue of sort of how we're managing all this stimulus money. And as you know, there's billions of dollars coming into the state of Nebraska. It's coming to consumers. It's coming to our fellow Nebraskans. It's coming to business in a variety of different ways. And so just wanted to share with you briefly some numbers, just to give you a quick snapshot. As you know, the first round of EIP or stimulus payments, and obviously the second round started hitting many bank accounts this week. But to give you kind of a snapshot, and we saw an awful lot of challenges with these payments that a lot of folks don't think about in terms of fraud, those kinds of activities. My father-in-law is a perfect example. He passed away the middle of 2019, but he got a stimulus check last year, and so trying to get that money back to the appropriate place. So there's a lot of those kinds of issues that we've had to work through. You also see the economic injury disaster loans, and many of those were forgivable loans at that $10,000 level, and that was really the first line of defense to keep small business doors open. And we had an overwhelming number of folks who were involved in that. Same issue, we continue to see some fraud related to those, but obviously that next round is underway as well. Touch briefly on PPP, and this is really where our members, and I know several of them are on the phone call. I heard Nick ask a question, or saw Nick ask the question. Obviously, we've got a great banking industry, and they've spent most of their last year living PPP. I'm not sure that when we're older and retired, whether or not we'll ever want to think about PPP again, but just to give you some snapshot in terms of the economic impact in Nebraska, this was round one that was passed last March. I believe it was passed March 27th. Started rolling out within the week. Quite frankly, that they weren't ready for the rollout in terms of what the Small Business Administration did. But you'll see there the U.S. numbers, $5 million in loans through that first kind of round in the process. About $100,000 average loan size when you look around the country. There were 5,460 lenders that participated in round one. That is just about every bank and credit union and a few more in the country. So everybody that was in with their customers. You'll see the Nebraska numbers as well in round one. Our Nebraska banks did 44,000 loans to the tune of about $3.5 billion. So think about the impact of that in Nebraska. And most of that was really in a relatively short time frame in 30 or 60 days. I would tell you, and they will not, I can't find anybody at SBA that will say it publicly now, but one of the first PPP, if not the first PPP loan approved in the country came through a bank in Northeast Nebraska. I believe they're represented on the call today, and the loan processed at 3:42 a.m. on the first day that they could get into the system. So our banks were working overnight to help make that happen. The other thing I think we saw from round one was really kind of the scope of the kinds of loans that folks needed help with. We saw loans as low as $300, and we had a lot of banks making those. Now, the irony of that is it probably cost the bank $500 to process it, but obviously first and foremost for us, the importance was our customers. You'll also see there in terms of just how the loans were made, both in terms of banks, other or fintechs and some of those kinds of folks, Farm Credit and the credit union industry here in Nebraska. You'll kind of see the differentiation and really where Nebraska banks stood out, and we were fortunate to be recognized nationally for that. Round two is underway. This was adopted on December 21st and started to roll out. New applicants were welcome, and then also prior applicants could reapply for additional funding. One twist this time, if you were coming back for kind of secondary funding, is that you needed to show a revenue reduction of 25%. There were also some changes in the system that allowed for additional farmers and ag producers to qualify. But I would tell you from our industry perspective, continues to be a challenge. We just got a rule change this week, literally dealing with small businesses. And so you think about how far we're into this cycle, and now they're changing the rules at the federal level. But that's an ongoing battle that we'll continue to have, and one that's relevant. I did want to point out, we did some video campaign work. These happen to be 5 of our customers across the state of Nebraska, both urban and rural, trying to understand sort of the impact, because I think that's the other thing our bankers are telling us is we got so busy with PPP that in many ways we forgot about the impact and the important role we played for our consumers. So you'll see there, and I was just had the chance last week to be up in Schuyler and had a chance to meet with Luis at the Burrito House. I'd highly recommend it if you're a Mexican fan. And you know, he talked a couple of times about the fact that he had to shut down for COVID twice. So big deal on his end, and one that was relevant. And so I just wanted to share that with you, and again, share those numbers with you. I'd be happy to take any questions. Just a couple things briefly on policy and regulation. We had a lot of technical banking things this year that were cleanup from COVID. We're fortunate that thanks to the work of the banking committee and the legislature, the majority of those are done. Our industry has also been front and center for quite some time working on financial literacy enhancements. If you look at LB 452, which was prioritized as a speaker priority, it does provide some additional requirements for public schools to teach financial literacy, and then also to require it as a graduation requirement for high schoolers. So that's something we've been supportive of. That's Senator McKinney out of Omaha in cooperation with Senator Slama from Southeast Nebraska. You heard our friend Senator Flood talk about LB 648 and 649, and we continue to work with Mike and his team. Obviously, we recognize that innovation and digital assets are going to be part of the financial sector going forward. So we want to create an environment that does it in a safe and sound manner and make sure that every business involved is treated the same in terms of regulation and capital requirements. So we continue to work with Mike and his team, and we'll continue to be supportive of trying to find a solution that's a win-win-win for everyone. And then many of the business issues you talked about, and in our world, I just listed a few federal things, but again, nothing of priority. So with that, I'm happy to take any questions if there are any, just to kind of share what else might be out there or if there are specific questions.
All right. Do we have any questions? Thank you for all that wonderful information, Richard. You guys have had an incredibly busy year, obviously, and we appreciate everything that you and all the members of the Nebraska Bankers Association have done for all of our small businesses and large businesses throughout the past year. So we do ask Richard a couple questions. We can't let him off as easy. So I need somebody to put a question in the chat or go ahead and unmute yourself and ask him a question. And Richard, do you mind unscreen sharing for a second?
You know what? I'm having trouble doing that. So if I could have the state chamber down, kick me out, that would be great. I'm not getting the button to unshare.
Gene, do you guys mind taking care of that in Columbus for us? And we do have a question for you.
Sure.
From a banking perspective, how concerned are you regarding the financial stability of the U.S.?
Well, we have about 3 hours probably for that conversation. You know, there's a lot of issues that I'm going to throw out there. Obviously, one of those is inflation that's coming at us that has a lot of concern for us, and whether or not what that might do to consumers and businesses across our country. I think the second piece of that is that we've got an awful lot of liquidity in our system, in our general financial system. And so I think that's something we need to keep an eye on. We are hearing more and more about the federal debt situation. And then I'm going to finish with the other thing that's probably concerning me a great deal at this point is as we look at commercial real estate, I think there's a real challenge, not now, but the next 2 or 3 years as businesses look to do business differently and they shrink their physical footprint. I think many of our banks who do a lot of commercial and commercial real estate are going to struggle long-term. And we may not see it as quickly because many of us are tied into leases that might, and I just re-signed mine for 9 years and 8 more months. So, you know, as we all begin to have those thoughts and thinking about what our space needs are, I think that creates some real challenges as well. So, you know, with everything, there comes innovation, and but there's also comes some challenges. So if anybody wants to talk about that in a greater in-depth, I'd be happy to visit about that.
Columbus, did that answer kind of what you were looking for? Do you want, like Richard said, we could talk about that all afternoon, and we still do have 3 minutes. So I know you also talked a little bit about college housing and things like that on the call I was on with you yesterday, Richard. If you want to kind of, I mean, that was just very interesting to hear you talk about that with your daughter's situation. And
Sure. You know, and that gets back to that commercial real estate. I begin to think about, and like many of you, I get to travel around the country. I see Chris Riley, my friend from ADM, on the call, and Chris and I, we bumped into each other around the country over the years, and as we travel and kind of see what's going on in other communities, there's been a real rush to build things like student housing projects. If you come around in Lincoln, we're on our third one. It's a $40 million project that's breaking ground right now. So I begin to have concerns about projects like those and whether or not they're sustainable long-term as higher education sort of evolves and figures out what their new normal post-COVID is going to look like. In my particular situation, my daughter's down in Hays, Kansas, and at Fort Hays. Go Tigers, if there's any Tigers on the call. But we are, in her case, she signed her lease for next year and it's going down $100 a month simply because there's not as much demand, even though student enrollment's going to be up. And so I think all of those things factor into that conversation about long-term planning about our economy and things that we need to keep our eye on. Right now, we're pretty fortunate the ag sector continues to do well and pricing is pretty darn good. We'd love to see the ethanol futures go up for those of you that have those plants. I own some stock in a couple of them. I'd like to see them go up, but I do think there's some things on the horizon that are going to be sort of headwinds we need to be a little bit concerned about.
thank you. Any last questions for Richard before we let him get back to studying up on PPP some more?
Thanks. I appreciate that, I guess.
We do also have a couple senators still on if anybody has a question for one of the senators as well. I guess, Richard, you also talked yesterday a little bit about kind of the rocket mortgage and things like that, rather than, if you want to just touch on that a little bit and kind of, concern there.
Good, you saved me from getting a question from Senator Flood, I think. I saw him on mute. I was like, he's going to give me a question I don't know an answer to. But, I would share with you one of the things that's changing and our industry has to do a better job with, and I think that's for a lot of Nebraska businesses, but our industry has to do a better job meeting the consumers where they are. And that ties a bit into Mike's proposal on the cryptocurrency issue. But, we see a lot of pressure, for example, from people like Rocket Mortgage. And so one of the things that we do internally, I have a couple of young staff members that like to dig into numbers. And so we will periodically create fake profiles and go out and apply for loans. And one of the things that you would find, and we really need to do a better job again with the next generation understanding finance, is that sure, you might be able to get a pre-approval from Rocket Mortgage as an example. Kind of like their great commercials that you see every time I turn on my television. But one of the challenges is a big chunk of those are not getting approved in Nebraska because Rocket Mortgage doesn't understand our state and doesn't understand their customers. They also, pardon my French, they fee the hell out of their customers. They charge exorbitant amounts of fees and then they roll that into the loan. And so a lot of times it may increase your payment by 58 cents or $1.50 or $3 a month for the next 30 years. So on the front end, the consumer doesn't understand it, but if you quantify that out over the long haul, you could find, I'll pick on Nick because you're the one that pops up on my screen. You could go to the bank in Fremont and you could probably get a loan with considerably less fees and a better interest rate and probably a quicker response. But again, I think the banking industry has to do a better job of meeting that next generation of consumers where they are with technology. And that's why the Rocket Mortgages of the world spend as much money advertising as they do.
All right, Senator Flood, did you have a tricky question for him or just something to add to what Richard was saying?
Do I? No, I appreciate the Northeast Nebraska folks getting together. I think our best days are ahead if we're all working in the same direction. And I know that just on the roads matter, we're all working in the same way. And we have serious depopulation issues in our rural counties. And if you look at what's happening with our population, we have and are likely to lose another legislative seat, quite possibly in our area. So we have pretty pressing issues that we have to confront, and I'm looking forward to working with my colleagues in the legislature to solve them. So have a good day, and I'm going to go down and continue the debate on gambling today.
Well, you enjoy that. Thank you so much for being with us. We really appreciate it. We do have Senator Lynn Walls from District 15 joining us now. She's had a busy day So we are so thankful that you are with us, Senator Walz, and I will let you have the floor just to say a few words on your priorities and some things that you're working on this session.
All right, can you guys hear me?
Yes, ma'am.
Hello, everybody. It's good to see you guys all in your green. Well, some of you are in your green. I'm not. I have a little green something on my collar. I wanted to talk about just 3 bills that are pretty important, I think, to especially my district. One of them is LB 99. It relates to limitations on blighted areas. Currently in our area, there's a limit on the amount of area that cities can designate to be blighted. And so cities of the metropolitan, primary or first class are limited to 35%. Cities of the second class and villages are 50% and 100%. But LB 999 would exempt areas that are declared extremely blighted from those percentage limitations. In Fremont, as Tara knows, we have a significant area that's eligible to be designated as an extremely blighted area due to several factors. And some of those factors included the flooding that we had in March of 2019. And without this bill, those areas would bump us over the 35% level, and we would not be able to develop, I guess, in those blighted areas. So this limits the opportunity for Fremont's growth. And sorry, I have about 4 people who are trying to get a hold of me right now. So if a developer were to approach us, we would not have the ability to designate those areas, and therefore our city would lose out on some really great business opportunities. Another bill that is pretty concerning to our area is in the Transportation and Telecommunications Committee right now. And it's a bill that I introduced that would limit train lengths to 8,500 feet in length. And for people who are sports fans, that's about, that equals about 28 football fields. We've had a lot of people, a lot of constituents and emergency responders who have waited well over a half hour to get across a train crossing, myself included. So not only is this putting our communities in danger, especially our communities in North Bend and Fremont and people who live in the Ventura Lake areas, but it's also, it's a danger for the people who are crew members on the trains. So the bill that I have would limit those train lengths to 8,500 feet. We have trains that are 15,000 feet in length that, you know, will try to come through our communities. And that, just to put it into perspective, equals about 50 football fields. So it's an issue that really concerns our constituents. I really wanted to talk today about my priority bill, and that is LB 542. I don't know if Senator Flood talked about this, and it's still being worked on in the Revenue Committee to determine a funding structure. But this bill would give the Department of Transportation the option to use bonds to fund our highway projects, specifically finishing the expressway system that was promised in 1988. That's a long time ago. We've been waiting for our expressway to be finished since 7 years after I graduated. That's a long time ago. So funding Nebraska's infrastructure into, you know, this century, ensuring safety and accessibility and providing economic growth and efficiency is really, really important. These bonds would have a really conservative debt service limit, and it also includes fixed interest rates that would not exceed 5%. And I don't think anybody would disagree that the expressway definitely needs to be finished. Inflation and construction costs have already raised the cost by millions and millions and millions of dollars since this project was initiated in 1988. And, you know, those costs are just going to continue to rise. So being able to have the option to bond just makes sense. And that's the priority bill that I'm working on.
So much, Senator, for giving up your time today. Did you get it?
Thank you, guys.
I am very pleased to introduce probably one of the busiest people right now we know of. They are with the Department of Health and Human Services for the state of Nebraska. I have Danette Smith, the CEO, and Dr. Anthone, did I say that correctly? They're going to give us a coronavirus update. So please join us, Dr. Anthone and Danette Smith.
We had a good streak going there for a while. Something else had to happen. So we'll give those folks just a few more minutes to hop on. Senator Rawls, again, thank you, and all the senators. It means so much for you guys to join us for this. We're very sad that we can't all be together and joining it, have a nice reception tonight, but we do appreciate your time. We know you are incredibly busy throughout the day, so thank you for joining us on the call. Donette, are you there and available to join us? Are there any other questions that we can ask the senators that are on the call? Or that we can answer as chamber executives? We take all the hard questions. We save those easy questions for the senators.
Okay, they're coming. Just 2 seconds. They're a little bit busy. They're in line to get their vaccination. No. They said that we can't hear them for some reason. Can we figure that out?
Why don't they, if you guys want to log off and log back on, let's try that and see if that will work.
I have made them a co-host from Columbus here, so they should be able to have more access as a host now.
Someone that's right below us.
Jessica Walker. And it's not muted on our end, Denise and Tara, I'm sorry.
That's okay. These things happen.
It wouldn't happen if we were all together in Lincoln today, but that's all right.
Ms. Smith, are you with us?
She's just coming back on.
Okay.
She's just logging back on. Hopefully now we'll be able to hear her.
Thank you to Columbus for helping us through our technical support today.
Yes.
So it really is a team effort when we get together. Thank you for bearing with us.
Yeah, happy to. It's a nice turnout. We had a high of 57 people on the call at one point. So very grateful for all the participation.
Cool. All right, Donna, let's try this again. Can we hear you?
Hey, can you hear me? Can you hear me?
Yeah.
Okay. Thank you so much for having Dr. Anthone and I today. I know we only have 15 minutes, but I thought that I would try to hit the high points. Dr. Anthone, who is our CMO, is going to really talk about some of the national data and also some of the Nebraska data that I think that you would find fascinating. So let me get started. As you know, we had COVID-19 start back in 2020, almost around this time, February, March-ish time. And we had a lot of citizens that tested positive, and we went right into Test Nebraska. And as you know, as people were getting tested throughout Nebraska, our new turnaround time, if you test positive, is a 1-day turnaround on Test Nebraska. There are other local public health departments that are using other test companies to help with testing to detect whether or not an individual is positive or not. Most of those entities, to get your test results back, it's done within 2 days. So we are very happy about how our system is beginning to respond. Well, as we were doing testing, many of you know that we moved middle of December, right into vaccinations. And of course, the middle of December all the way until the 1st of January, we started testing all folks in long-term care, assisted living, our medical providers, because after all, they are the ones that have been providing all the essential care for us in the hospital. Dr. Anthone's going to talk a little bit with you about hospital beds, because you know the governor tells us a lot about hospital beds are the indicators as to where the system is, whether or not the system is getting healthy or not. And so I'm going to let Dr. Anthone kind of talk about that. For those of you all who have been on the calls with me, and I will be starting my monthly call again, probably toward the end of March, I've been talking a lot about the vaccination and the vaccination rollout. As you know, there are 3 vaccinations here in Nebraska. We have Pfizer, we have Moderna, and the new vaccination is Johnson & Johnson, which is a 1-shot only. The other 2 vaccinations are 2 shots. If you were to go to my website, and I want to encourage you to do so, if you have persons that need to get registered, we'd like for them to get registered on vaccinate.ne.gov. That's our state portal. That's vaccinate.ne.gov. That's our portal, and that portal helps us with making sure that all Nebraskans get registered. They get registered, and then when their prioritization occurs, they will be receiving an email from that local public health department about where they need to go to get their shots. To be able to accommodate those people who do not have an email or have questions about registering for the vaccination, we encourage them to call our local toll-free number. That number is 531-249-1873. Again, number is 531-249-1873, and the toll-free number is 833-998-2275. Many of you know that at this time, we have completed in the state of Nebraska approximately 219,000 persons in Nebraska have completed their vaccination, which represents approximately 14.8% of the population. And I'd like to give a yay out for that because that's very good. If you go on our website, you will notice we're showing 2 programs. One has to do with the federal vaccination program, and the second one has to do with how we are coordinating with the local public health departments to get vaccinations out. I'd like to do a rumor bust if I could. There is a thought that the state of Nebraska has real large refrigerators somewhere in Nebraska, and the vaccinations, or what we call the product, comes into Nebraska, and the Department of Health and Human Services is storing them in their secret location. Well, that's not true. We want to bust that rumor. That is not true. What happens is we oversee all of the orders that go into a federal system called Tiberius, and Tiberius completes those orders through the CDC, and the CDC brings all of, ships all those orders by FedEx to our various providers and local public health and FQHCs to make sure that we can vaccinate. Our role is to make sure that we understand the numbers, that we make sure that vaccination is equitably spread across the state so that those Nebraskans that want to get vaccinated can do that. So if you go to my website, you will notice that we've had a total allocation of 658,000 dosages here in Nebraska. On our federal program, we are at 164,000 dosages for our federal program, and that is the Walmarts, CVS's, Walgreens, who are handling the vaccinations for the federal government through our retail pharmacy program. So as a state, we're doing very well. If you are reading and looking into the New York Times, you will see that the state of Nebraska is at 20 right now out of all the states in the country, and we're pretty happy about that. We bounced between the 13th ranked in the country to the 20th, and a lot of that has to do with our data. It makes it fluctuate. And then we've also been #1 in the country for ensuring that all of our long-term care providers and ALFs have been vaccinated. And we're very pleased with what the data is saying about the work that we're doing. We have the ability, and we have very good long-term care, as well as local public health departments who are working closely with us. Our medical providers are working closely with us to make sure that as we get that product out to them from the federal government, that inoculations are happening in real time, and we're trying to calculate that. So I'm going to be quiet right now. I'm going to let Dr. Anthon kind of go over some data with you, and then if you feel we have time, we'll answer any questions. Dr. Anthon?
Thanks, Danette. I see in the chat room, there's a question that I'll probably just want to answer right now, if that's okay. And that is about, as Danette said, about the 3 vaccines. Is there a ranking, or is there one that's better than the other? And the real message to get out about the vaccines is that all 3, the Pfizer, the Moderna, and the Johnson & Johnson, are all the same as far as preventing hospitalizations. In all the trials that were done, all 3 vaccines prevented hospitalizations. Not one patient that received the vaccine required a hospitalization, and all 3 prevented deaths. Not one death in any of those trials among the 3 vaccines. So you might have heard there might be a little bit of difference as far as the effectiveness goes, but in the things that count, hospitalizations and deaths, all 3 are equivalent. So that's why we say when you get your chance for a vaccine, to go ahead and get the one that's available, because all 3 will prevent you from being hospitalized or dying. As Danette mentioned earlier on, we learned even back as far as March and April of what we should use as a state, or what guide should we use to know when things are not going well or are getting better. And the one metric that we knew we could rely upon was how many people were going to the hospital, because that's something you cannot change. Either people get sick and need to go to the hospital, or they don't. We tried to use other metrics like test positivity rate, or how many people were testing positive, or other metrics like that. But the one thing that wasn't manipulable was people going to the hospital. So we've used that as our North Star, our guiding principle since the very beginning of the pandemic. And I'll just give you a current status of where we are as far as hospitalizations go in the state of Nebraska, and where we were maybe back at our peak. And just so you can sort of compare to where we are now to where we were when we were really getting concerned that maybe our hospitals were starting to reach capacity. So today we have 131 patients statewide in hospitals for COVID-related diagnosis. Back in November 20th of 2020, we were close to 1,000 patients in the hospital. So you can put that into perspective. We only have 130 patients now. We had close to 1,000 back on November, right around Thanksgiving. At the same time, we had quite a few patients. Of those 1,000 patients that were taking up ICU beds and on ventilators. Currently, we only have about 40 people in the state of Nebraska in an ICU room for a COVID-related diagnosis, and only about 20 of those are on ventilators. So back in November, we had over, I think, close to almost 250 patients in the ICU and over 180 patients on ventilators. So you can see the different situation we're in now as compared to back in November when we hit our peak. As a matter of fact, when we hit our peak, we were worried not so much for not having hospital beds, but as far as staffing for those beds was becoming a concern, because a lot of those nurses and other staff were getting fatigued. And we as a state did provide some help to those hospitals as far as helping bringing in maybe outside staff or incentivizing their own staff of the hospital for picking up extra shifts, or maybe working an extra overtime shift or something of that nature. And that sort of helped us through that time in November when we were at our peak. So again, our hospitalizations, our ICU, and our ventilator status is probably at its lowest level since way back in September and August of this year, when we were at our lowest point. We had a little bit of a peak, as you might remember, back in May when we had some outbreaks at some of our meat packing or processing plant areas. But since that time, our next peak was right around November, and we've come out of that peak now and sort of plateaued out as far as how we're doing hospital-wise. So it could have been better timing for having the vaccine come on board so that we don't have to go back into another surge. And we're hoping to prevent that as we get more and more of our population vaccinated. we've tested about 50% of the Nebraska population. So that's unique. That's not like people getting multiple tests. 50% of Nebraskans have at least tested once for a COVID test. Of those, about 10%, almost 11% now, have tested positive. So if you consider those people that have been infected and tested positive, we're at about 11% immunity maybe, if that immunity does last for several months. As Danette mentioned, we're close to 15%. Actually, we're a little bit over 15% right now for people receiving both vaccines or at least one shot of the J&J vaccine that only takes one dose. So right there, that gets us up to about 25% of immunity in the state, which is great. We're getting there, and it's adding more and more. We also get data from the CDC and from the Red Cross on people that give blood for other purposes, like say you just go into the hospital and you give blood for a complete blood count or some other test. The CDC says that people that really never knew they had an infection, about 25% of those people have antibodies. So that gives you a little bit more idea of how much immunity we have in the community. And the Red Cross shows that about 40% of people that go in to donate blood that never thought they might have been infected have positive antibodies for COVID. So we're getting there as far as immunity goes. We're not there yet. As you know from watching television and knowing all the news reports, we'd like to get up to about 70% of immunity in our state before we really know that maybe we can go back to some sense of normalcy. The other issue that's ongoing now, that's a hot topic, I guess you could say, are these variant strains that you're hearing about. And what is the status in the nation, in the United States, and in our area as far as the variants go? Well, back in September of this year, United Kingdom, England, started noticing that their most common strain of the virus that they were seeing was not the real initial virus that they saw way back in the spring. It was a new variant. And that variant's called the UK or United Kingdom strain. And that's the one that was most concerning for coming over here to the United States. And so far, we have seen we're up to about 5,000 cases here in the United States of that United Kingdom variant. And here in Nebraska, we have identified 12 cases of that United Kingdom variant. But probably of most concern here in the United States are our own variants, particularly the one that's coming from California. And we've identified 21 cases of this California variant. You might want to know why we even care about these variants, but these variants have become more contagious or more transmissible. The UK variant is actually about 50% more transmissible, 150% more transmissible than the initial strain that we saw back at the beginning. And now we've found out that the California variant might not be as good, or the monoclonal antibodies that we have for that variant are not as good as they are for the wild type. So we're keeping a good track of that here in the state. We have our own lab at the Nebraska Public Health Lab that's making these sequences so we can see how many variants are coming into our state. But again, it couldn't have been better timing as far as having the vaccine come out. At the same time, we saw these variants start developing here in our own country and coming from the UK, and there's a Brazilian variant and a South African variant. So far we're doing very well. Again, our North Star will be how many people are hospitalized. That has been completely stable over the last 15 weeks. We have seen a decline in the number of people in hospitals week over week for the last 15 weeks. So we want to keep that trend up. And so far, I think we are. So I'll turn it back to Danette.
Thanks, Dr. Anthony. Can you answer that question that's in the chat? I don't have an answer, and I haven't been on the sale lately, which is there any information regarding vaccinations if you get a new employee or a new resident into one of the long-term care facilities? Has Dr. Ashcroft said anything about that as of yet?
As of now, for long-term care facilities, the data that I've heard about show that almost close to 100% of long-term care facilities have given their residents at least the opportunity to get vaccinated. So almost 100% of long-term care facilities have had the opportunity to vaccinate their residents, and their staff. The percent of the residents that have taken that vaccine is close to, or even above 90% of those residents of those long-term care facilities have received the vaccine. As far as the staff go, it's a little bit lower, maybe closer to 60 or 70% of that staff. And we know there's going to be new residents admitted to these long-term care facilities, and obviously new staff coming on board to staff these long-term care facilities. And the question is how will the new residents and the new staff get their vaccine? So as of right now, we're working with the long-term care pharmacies and the local public health departments to take care of that, so that when their new resident comes on board or new staff comes on board, they'll be able to get that vaccine either through their long-term care pharmacy that they're contracted with, or be able to contact their local health department and get vaccinated through that mechanism. So that's the best way to answer that question.
All right, I think we have one more question come in. Do you anticipate that the COVID vaccine will eventually become a required vaccination for educational institutions?
Well, I don't know. That term required is a little bit of a tricky term, but I think right now the studies are ongoing as far as children and adolescents. As you might know, Pfizer, anyone 16 and above can receive the vaccine. So that'll take care of some of the adolescents. But the studies right now are ongoing. For I hear Moderna just started a study for children aged 6 months up to age 12. And Pfizer has also got an ongoing study for, I think, between ages 6 and 12. Now, whether they'll be required or not, I don't know that answer at this time. I can't tell you what will happen there. But we're hoping that just like through the whole pandemic, that Nebraskans will do the right thing and want to get vaccinated. So that's sort of the best way to answer that question right now.
Perfect. Well, thank you guys so much. We know that you have worked tirelessly for the past year, and we are so incredibly grateful for everything you've done. We encourage everyone on the call, of course, to get vaccinated, and everyone to do their part. You will finish strong. So thank you very much for everything. With that, it is about 1:30, so we're going to wrap things up. 1:29, look at that, on the dot, we're going to be done. So again, thank you guys all so much for your time today. We truly appreciate it. You are amazing members of all of our chambers, and we are truly blessed to have all of you. Enjoy the rest of your day and stay safe.
Same to you, and thank you.
Cheryl and Jeannie, I saved the chat on a Word document and I'll send it to the whole group. It's got some of my stuff, so I don't know if there's backside conversations that other people were having, but I'll try and glean it so it's relevant to who is actually attending.
That would be great. I started the recording just a hair late, so we might have to do a little tricky introduction to it, but it was right when Mike Flood was talking. So we'll do our best and provide the link to everybody then. So.
Okay, sounds good. Thanks for
Thanks,
hosting
Liz.
on the Zoom end.
You bet. Thank you. Have a good day.
Bye.
Bye.